Hi everyone, how are you? Welcome to another question and answer session for MRCS exam. This is the question. A 72 years old lady with osteoporotic fall and sustained an intracapsular femoral neck fracture. The fracture is completely displaced. Which of the following vessels is the main contributor to the artery supply of the femoral head? So here first point is important that this is the 72 years old lady. Then osteoporotic fracture occur in the anterior capsular femoral neck. So femoral neck fracture occur and it is completely displaced. So this 3 point is very important. First of all, it is the 72 years old lady, then femoral neck fracture and which is completely displaced. So and we have to find out the main contributor of the artery supply of the femoral head. So this relation are very important. Here the options are deep external parental artery, superficial femoral artery, external iliac artery, circumflex femoral arteries, superficial external parental artery. So now see some of the picture. So in here we can see this is the femur and it is the head, neck, crater and larger trochanter, then shaft of the femur. And we can see here that the medial and lateral circumflex artery, and these artery they arising from the profunda femoris artery. This is the profunda femoris artery or deep femoral artery. So from the profunda femoris artery, medial circumflex femoral artery and lateral circumflex femoral artery, they are arising and they going towards the head. You can see this is going towards it also going towards the head and supplies the head. In case of adult, it is true that the medial circumflex femoral artery and lateral circumflex femoral artery, they supplies the femoral head. Then we can see in this picture also, this is very clear picture. Then we can see this is the medial circumflex femoral artery, here the lateral circumflex femoral artery, and here we can see the retinocular branch arising from the medial circumflex artery and lateral circumflex artery. Here we can see this is the retinacular branch from the circumflex arteries. So this is the normal blood supply of the head of the femur. Here we can see the in the head there is the blood vessel, and this blood vessel arising from the retinacular branch from the circumflex femoral artery. And we can see the artery of the ligament of teres or foveolar artery. This usually present in child and it supplies in child for early life. So in this picture here we can see this in case of child, and in case of child we can see the a large part of the head of the femur is supplied by artery to ligamentum teres or foveolar artery. So this point is very important. In case of child, this head of the femur is supplied by the artery of ligamentum teres together with the circumflex artery. In the second picture we can see this is very clear. In case of child, this is the artery to ligamentum teres, or it is the foveolar artery and arising from the obturator artery, and it supplies the part of the head of the femur in case of children, not in adult, and in adult it is supplied by the circumflex femoral artery. So our answer is now ready, that the circumflex femoral arteries, they supply the head of the femur through the retinacular branch, and due to complete fracture and displaced, here we can see the neck is complete fracture and displaced, then this artery will be cut off. So our answer is circumflex femoral artery. Thank you all.